To get an even bigger picture, this is the entire cycle of all chronic disease in one slide. Bad life circumstances or bad lifestyle choices are the underlying cause. Brain imbalance, hormone imbalance, poor digestion, chronic constipation, inability to eliminate waste, chronic injuries, inflammation, particularly to the spine or skull, lack of exercise or over-exercise, toxic exposure, nutritional depletion, skipping breakfast or screwed up rhythmicity, high stress of any type, infections or poor gut diversity in the microbiome, chronic sleep deprivation. Okay, is that a complete enough list? Lifestyle choices or circumstances. So circumstances is this. Let's say you're a 6-year-old boy and your adrenals are all messed up, you don't poop for every 1 to 5 days, you have a chronic spinal injury from sitting in front of a television for 6 to 8 hours a day or at a desk, you don't exercise, you're exposed to gluten, dairy, lots of shots and so on, you're eating ramen noodles for lunch and SpaghettiOs, you don't have really good routines, super high amounts of stress, you have a chronic infection in the gut that no one figures out until 20 years later, and you're chronically sleep deprived because you have severe insomnia to the point where it stunts your growth. And how do you figure out I was talking about myself? Okay, so I'm a 6-year-old. I don't know any better. That's circumstance, not a choice. Do you understand? All right. Circumstance, choices, plus genetics equals one of the 4 or a combination of the 4 adaptive responses. What's an adaptive response? Stress. Stress. It's to try to cope. This isn't the body being stupid. It's the body trying to cope. I gotta put a blinker on this thing. All right. All right. I'll stand back. Maybe it'll be safer. Then I'll probably run into this thing. Inflammation, blood sugar dysregulation, tissue breakdown, free radicals. Chronic adaptation plus your genetics creates damage to one of the 3 major systems, your neuroendocrine, your gut, or your detox systems. Chronic adaptation plus genetics equals sad kitty. Okay? Symptoms. Alright, so just look at the sad kitty. He looks all his hands over his little paws over his little tummy. Okay. Fatigue, low mood, indigestion, weight gain, cravings, insomnia, chronic pain, hot flushes, or 90% of your entire patient base. Symptoms plus coping equals bad choices, and round it goes. Does that make sense? Okay. So you use lifestyle assessment through the 10 pillars to identify what the underlying causes were, and then give the specific prioritized lifestyle recommendations to your patients. And at the same time, you use functional labs, like Dr. Crawford was mentioning. You use case history, you use symptoms to identify what the adaptive responses are, what organ systems are failing, and you give the nutritional protocols you learned here, or any other place that you know is effective, coming back through the eyes and lens of Y-files, to not only reverse the symptoms, but reverse the entire disease completely. All right? If you are just focusing on giving people pills without correcting their lifestyle, it's just going to recreate itself later on. All right? That's why we focus on lifestyle. You change their diet, you change their brain rehab, you find the causes of stress, you know, all these other things. All right? So, now, as you can, each pillar is a good 1 to 10 hour lecture by itself to go into its entirety. All right? You've caught a lot of brain stuff this weekend. How to identify and balance an imbalanced brain. All right? You've learned a lot about adrenal, thyroid. There's so much in here, but you are by far better equipped than almost every other clinician out there to help with this category. This is the one category no one deals with out there except for you and the neurodocs. Bowels, it's asking how well do you eliminate waste from the body, how often do you have bowel movements, do you even know what a good poop looks like? I mean, how many of you have actually been taught what a good turd is? Alright? Alright, so this is a question you should know the answer to. Alright? So, you should go at least as many, ideally you should go at least as many times as you have a meal, like your ancestors did. If you don't That's at least, think of at least 12 inches a day. I don't care if it's in 1/12, 2 6s, 3 4s, but you've not more than you shouldn't go more than 4 or 5 times a day, because then you got the absorption issue. It's going on too quickly. All right, well formed, easy. I'm sorry, this may sound like, why is he talking about this? But if you don't get rid, if you live in a house where the toilet can flush, not for very long, right? Okay, same thing in the body. Now, the adjusting, of course, will help. Now, these are all feeding in on each other. They're not separate, but for visual purposes, it's easier to keep track of. There's so many things to improve digestion. All these things will help. Fixing the physical. This is all of chiropractic and body techniques. Exercise, learning how to do high-intensity interval training, encouraging your patients to walk, getting them to stop jogging. If they are really into having a midlife crisis marathon, like they just got to run that marathon to prove that they still got it, then you can teach them how to walk, sprint, not jog and destroy their hormone system. Tame your toxins. My question, I have an online secure questionnaire that is based exactly on these 10 pillars. I have about 40 questions just on toxic exposure. So I can quickly assess, based on category, why is the pillar crumbling and how can we fix it. You can actually just organize your whole thinking around a specific system like this. Asking about alcohol, asking about over-the-counter drugs, makeup. Makeup is loaded with lead, as Dr. Brzezinski mentioned. Artificial sweeteners. Now this is obviously just a super short sample of it. In New Zealand, alcohol is a big problem. You basically have to how many of you saw the TV show Lie to Me about the Ekman work on microexpressions? Okay, watch the first season. The third season gets pretty dark, but the first season and a half is really good. I basically set up my intake because I know my patients in New Zealand lie to me about alcohol. You start the consult with really easy, low-ball questions that they say yes and no authentically. Then you get a read on what their authentic yes and no is based on their facial and body postures. Then when you ask them, when you question them about their drinking and they do this, you know they're bullshitting you. Got it? All right? So there's even more complicated things that go into an assessment, is to know when your patient is lying to you. And especially around alcohol. We even heard it today, a story about alcohol, someone's not being forthcoming. What I do is in my questionnaire, I put in the questionnaire, the CDC defines heavy drinking for males as over 14 drinks a week. And for females, it's over 7 drinks a week. So they actually have it confronted right when they're doing the survey. So they're pre-framed. By the way, I've confronted about 6 patients on their alcoholism. 2 I never saw again. The 4 got sober and thanked me for it. Because I was the only one who had the spine to actually confront them on their alcoholism. If you confront your patient and they don't come back on their addiction, I'm not so it's a mixed bag. We should be congratulating yourself or not, because you should. It's always a risk. Because if you build enough rapport, you can basically save their life. But if you don't build it up enough, you can lose them, and then they'll get more defiant, may go on a bender. So build rapport. By the way, doctors get sued by patients that don't like them. If you have a great rapport and you are genuinely doing your best, and you're trying to make amends for a mistake, which will happen in your practice, okay? You won't get into trouble if you have a great rapport with your patient, because the patient will give you the benefit of the doubt that you didn't intend to do this and you weren't being negligent. Obviously, if you're grossly, but if you're in this class, I'm on the assumption you're not going to be grossly negligent. All right? Welcome to the club. If you make a mistake. So if you have a rapport, you'll be okay. Nutrients we talked a lot about. There's huge amounts that goes into nutrition. I have one lecture alone that covers the 16 major diets in about 50 minutes. Breakfast, knowing the questions to ask about breakfast, about routines. Stress, there's there's a lot that goes into the stress category, everything from relationships to overwhelmed clutter to multitasking to exposure to fluorescent lights to screen time to addiction use to all sorts of stuff. Biome, probiotics, mold. Mold is a massive issue, at least in New Zealand. I know it's a massive issue around the States as well. Any history of infections, digestive issues, because if someone has a bad infection, it can screw up their gut and then screw up everything else. And sleep is understanding how to assess and help someone with sleep. If you can get someone to improve their sleep, you can basically cut off 30% of their recovery time, just with sleep alone. Right? Almost everyone's sleep deprived. No one knows how to strategically nap anymore. I wrote a blog post about how to nap, and I wrote it for my nursing patients, because nurses I think by far have one of the hardest jobs on the planet. They're being yelled at from above and below, from the patients and from the doctors and admin. They're exposed to all these horrible chemicals. They got all these fluorescent lights. They're on shift work. They're eating crappy food because they're just coping with sugar and coffee and all sorts of stuff. They don't get exercise. They get injured because they're lifting patients that are defiant, or like the person how to help them lift, like drops a leg or something. Very, 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 very hard profession to be a nurse, and very badly sleep deprived. And they're making life and death decisions. And so I wrote an article teaching them how to nap. So spoiler, between about 1 to 3 or 2 to 4, 20, 30 minutes, you can buy apps now for it. So those are 10 pillars of health. Now, this is a very big model. How many of you found this useful? Is this useful? Okay, you can see the triangle of health buried in it. Physical, biochemical, mental, emotional. So it's just building on what you already know to make it much more specific and helpful as a framework going forward. This is the big picture. How do you assess lifestyle? Understanding the role of choices and circumstances filtered through your personal genetics, creating adaptive responses, chronic adaptation through your personal genetics, creating damage to the 1 to 3 of the major body systems, chronic breakdown through your personal genetics, as filtered through it, creating symptoms. Symptoms plus coping equals more poor lifestyle choices, and around the circle goes. Alright? So that is all chronic. This is what I teach my patients. This is when I give lectures. I said, okay, here's all of chronic disease in one slide. Ready? Buckle up. And it's like they walk out understanding why it's not a mystery that they're unwell.